So in cervical cancer this year at ESMO, we actually had almost something for everyone. The first thing to mention would be our presidential presentation of the INTERLACE study, in which induction chemotherapy was found to be improving the outcomes of women who then go on to receive standard chemo-RT. This resulted in a 10% increase in overall survival. And the reason that's so exciting is it can be implemented today. So this was giving just 6 cycles of weekly carboplatin paclitaxel prior to the chemo-RT. And it doesn't require a drug approval. It is practice changing now. Following on from induction chemotherapy prior to chemo-RT, we had the A18 study in which Pembrolizumab was added in to chemoradiotherapy and then following chemoradiotherapy. And that also was a positive study with an improvement in PFS and OS trending in the right direction, although it's too early at this stage. That is supportive of previous data from the Keynote 826 study, which has now been data that we've had for some years. But it's really encouraging to see that if you add additional small amount of chemotherapy and additional IO in both settings of chemo-RT and persistent or advanced metastatic cancer, there is an efficacy. So we know that we'll be able to do a lot more with that data from there. And then finally, again, another exciting ADC and another presidential presentation for gynecological cancer, again in cervical cancer, and this time in the second-line setting. So the ADC Tisotumab Vedotin, also known as TV, in which tissue factor directs the microtubule cytotoxic MMAE. We saw a positive study with a 30% reduction in the risk of death. And in second-line cervical cancer, that is just outstanding. It means that we've got new options. We know that there are trials ongoing and in design for combinations of these ADCs that I've mentioned with other therapies, including with immunotherapy. And so the excitement's not just going to stop here. It's really a great day for women with cervical cancer.